All right. Hey, how are you? Good to see you. You staying out of trouble?
Yeah.
What a drive. When you started? What time did you start?
1 a.m.
1 a.m. All right. Well, we're going to go ahead and get things rocking and rolling here for you. Take a little bit to get things going. You actually have graduated into the ranks of professional strong women, haven't you? Yeah. And then also in addition, now you and Ryan are putting together the Southern Illinois Strength Expo.
We are.
And when's that coming up?
February 10th.
February 10th
Yeah.
of 2024, right?
Yes.
So we'll
And
go
you're
ahead
coming?
and am I coming? Yeah, I think so. What I'd like to do is, and I know Ryan and I talked about, you and I touched base on it just a little bit, is like with official Strongman Games and Lynn Morehouse and that crew, like to go ahead and do a class so that we can go ahead and teach other doctors how to do what we're going to do with you today. And some of that actually, hopefully, will be X-ray analysis interpretation too. Talking with radiation services out of here in Indiana to go ahead and try and make it to where we can kind of get chiropractors caught up with what things they've missed in chiropractic college. Unfortunately, what we're finding is a lot of these doctors are not getting fully trained in x-rays because they really frown on taking any x-rays at all at the colleges. So this is becoming a lost art.
Yeah.
And so my hope is that with the help of the International Chiropractors Association and the like, we'll be in good shape and trying to change some of that and get them up to speed, and maybe they'll start using x-rays again. I don't know, right? So, but we're going to do what it is that we can, and I appreciate your help if we're able to go ahead and partner with you guys on that. So
Love it.
that'll be freaking awesome. All right, well, we won't need your shoes on for this fancy schmancy gig here.
Cool.
So I'm gonna have to lower this a little bit more and center you up. So the nice thing is we've pretty much utilized every square inch of this place.
Right.
So,
Yeah, you have.
Right? So 600 square feet. I think honestly this is probably the chiropractic office of the future. So truly. All right, so if you would go ahead and come here.
Yep.
And I'm going to wrap this fancy thing around you. So you just keep getting more and more muscle on that body of yours, kid.
I have to keep up with these girls.
Holy smokes, isn't that something? Holy smokes. All right, so the line straight up and down, we call that the butt crack line. So guess what goes there?
Got it.
You got it. Go team. All right. Get that in there. Rock it in. Roll it. Let's see what we got here. Actually, it's almost like I know what you're doing here.
I'm done in a time or two.
Yeah, all right. We'll take this here, drop that down. Okay, if you would, please go ahead and just take a partial step that way. Good, right there. Oh, a little too much. There you go, perfect. All right, good, you're dialed in now. All right, so you see that little hole right there? That's what you're looking at there.
All right.
And let's go ahead and get these pictures going. And take that. All right, so you comfortable where you're standing?
Sure.
All right, hold it right there. Don't breathe, don't move. Smiling's optional. Thanks for playing. All right, don't move from that spot, but you can breathe. All right. All right. You know, that is so close. I don't like it.
Okay.
I'm going to drop it just a little bit more.
Okay.
Because as far as I'm concerned, if we're going to do this, let's go ahead. I tell you, I couldn't have gotten hardly any closer. Everything else is set up perfect. Take that right in there. Dosage is minimal. Look, do the same thing again. Good job. And you can breathe again. There we go. So, take this around, put that around. All right. So, there's 5. What do we got here? Where'd it go? Where'd it just go? There it is. Holy smokes, that freaked me out just a little bit because it was like, okay, now hold it. Where did that thing go? So 5, 4, 3, 2. All right, I don't see a zigzag on there. So we're going to go ahead and skip this. I'm going to go ahead and go to a left. All right, so if you would, just go ahead and face that way, Chris, cross your arms. Look at Lee Haney there. See old Lee? Just hung out with Lee just a little while, just earlier this year.
Really?
Yeah, actually a few weeks ago. Go ahead and move forward just a little bit for me. And then your butt can touch that. I don't want you leaning, but it can touch that. All right, and go ahead and move forward just a half a smidge. Good. I think that will work. And go just a little higher there. Okay. You hold that right there, look straight ahead. Don't try and arch or anything, just kind of try and be as normal as you can be. And hold it right there. And don't breathe, don't move. Okay, you can breathe. And it's a great picture, so you can move also. All right. So, and there. And that's a left. So put a little L in there for you. All right, so you can see you got a curve right in through here. This starts to slide backwards, but you see how flat that is in through there? That suggests there's some grabbing or some spazziness in there. Uh-huh. So the other component is that your pelvis is rolled way forward, so you see there's hardly any pelvis on this side. Most of it's on here, and that's coupled or confirmed with the other thing that I see right in through here. You see those are like cat eyes?
Yes.
So they're like this.
Yes.
What they should look like is like eyes, right?
Okay.
And so when the pelvis tilts forward, it changes or distorts that image.
Okay.
So that allows us to see that. It also looks like the pelvis is opened up like this and there's a little tilt. So we're gonna get in there and see exactly how crazy messed up that is too. I don't have to do this one. So we're gonna hit delete on that one, go right into the thoracic. So again, this time, what we're gonna do is we're gonna go ahead and line you up. And this should go right on your sternum, which is a win. Okay, you doing all right?
Yeah.
Now, do you have a big cross or anything there on your?
It's a heart.
Okay,
It's
let's
glass.
move it. Here, it's okay.
Let me hold.
No, here, no. I'm just gonna move it over here.
Sure.
All right, there you go. Tanks, you're all right. I don't care what anybody says about you. You're all right in my book. All right, so hold that right there. Thoracic, superior, dorsal AP. All right, hang on a sec here. This thing here shutting down. And it's going to deactivate. Now I got to reactivate, and then it's got to cycle through again. So, and technology, right?
Right.
Great when it works.
We
All
should
right.
have it.
I know, right? Look straight ahead. Don't breathe. Don't move. Yeah, it's crazy. A lot of people don't realize it, but there's a little plate in here. That plate goes to this device. That's $37,000. So this machine here, this is a new machine, $26,000. Yeah, crazy, right?
That's a lot.
A new chiropractic doctor coming out of school, $300,000. That does not include their undergraduate degree. So, you know, each chiropractic table right now, I paid, I think, around $8,000 for that table. That table now costs $10,000 to $12,000. So, yeah, and you know, and then you go and you look at it. I mean, a lot of chiropractors are like, oh yeah, you know, I need to, or a lot of chiropractors, but the patients out there. Well, you know, I just want to pay $20 for an adjustment. And it's like,
It doesn't work like that.
how can you afford to eat? I mean,
Right.
there's no food, you know. All right, so let's do this. Let's do, I'm going to do left again. You got a little hiccup in there, so let's go ahead and do facing lead again. This time, however, we're going to do a little different. So put your right thumb here and your left thumb there. So just like that. There you go. All right, so what we're going to do now is we'll raise this up just a smidge, and let's go ahead and have you move forward just a little bit. Okay, a little bit more. We're doing good here. Go ahead and a little bit more. Yeah, you're doing really good with the smidge stuff. So go ahead and do 2 little bits more. You are really good at this. I tell you, you know, I bet you were great at Simon Says too.
Right.
Simon Says Champion 2008, right? All right, you hold that right there. We'll go ahead and get this rocking and rolling here for you. And I gotta bump it up a little bit because you got a little bit of muscle in there, right? So, all right. Good job. Okay. So again, you know, as we go ahead and continue up in through here, you see how that gets really tight. Even most of the time, if I go ahead and I extend in through here, my back will flatten out. You see how yours
Mine does not.
is kind of like a wrestler. you're kind of like this, right?
Right.
But it's a curve right in there in the top range. So a lot of times what I'm starting to see, well, it's not that I'm starting to see, it's chiropractors do it a lot, is that they'll go ahead and they'll try and give you the big old hug wrap around. I never do that because we get a lot of people who already start flat. That actually causes extension. That extension really makes a lot of problems for the joints themselves. It makes a nice crunch, but is that what you need? We need to figure out why this is locking up in through here, right? So a lot of times they'll hit the areas that are crunchy. Well, you know, it's just like the crack addicts on YouTube. It's like, well, just because it crunches doesn't mean that's what you needed.
Right.
You know what I mean? And not always will you find that, you know, the crunching is going to give you the right treatment pattern. It just makes noise. All right, so let's do. And I had an opportunity, I don't know if I told you or not, I had an opportunity to have a TV program that was going to be produced out of California. And they wanted me to start wearing scrubs. They wanted me to do different than what I do in here for you guys. And I turned it down.
Good for you.
I told him, I said, you know, I'm not going to just go crunching bones just to be on TV. I said, you know, for me, it's more about trying to make sure that you guys are getting what you need and screw that other stuff, you know?
Yeah.
So, but, you know, they got somebody else that does it and that's fine, you know? So, and she does a good job. She represents well, I think. So, I look at it as a win.
You get to do what you do. And
I do what I do. Let's put your back up against there. Now I'm going to go take pictures of your neck. See what that thing looks like. So far, I don't see anything that needs an amputation. So
good, that's positive.
I know that's the worst tater, the amputator. You know, I know. There he goes. There you go. Dad jokes coming out now, right? Yeah. There I go again. Take that right in there. AP. All right. So just look straight ahead. Make sure you're nice and squared up in there. Don't breathe. Don't move. Again, smiling's always optional. Thanks for playing. All right, don't move from that spot, but you can breathe, okay? All right, okay. Well, this is probably the worst part that I've seen so far.
Hey.
I know. That's all right. You know, I keep it real. It's like, ooh.
I hate my neck being messed with.
I know, right? It's just like, ooh, look at that. That's bad.
But it has been hurting, so.
Yeah, well, it ain't hanging in there where it belongs, that's for sure. But, all right, so I think we can do that. Let's go ahead and just open your mouth big and wide there. Perfect. Hold it right there. All right, hold it right there. Don't breathe, don't move. Okay, you can relax. And perfect.
My piercings look funny.
Oh, well, you got piercings, you got your hair clip in there.
No,
You've
that's
got,
my veneers.
oh, the what?
Those three
This
on
hair?
front. Oh, yeah, that's my hair.
That's your hair thing?
Yep.
This hair? I don't even know what that is.
It's my piercing.
Okay.
My tongue's pierced, Todd.
Okay. All right. I don't even understand why anybody do that, but okay. You have to tell me at lunch or something.
Okay.
Yeah. Doc, this is what we do now. Okay.
I'll bring you up to speed.
Yeah, well, yeah, I am I'm a little behind, I think. Just a little bit behind. As a whole, just a little bit of a slide to that right in through there. So, take that, and then, yeah, see how that leans?
Yes.
So, if you were a brand new baby, you know what your name would be?
What?
Eileen. Another dad joke. That's awesome. You're welcome. I'll be here all week. Oh, this week's short.
Yeah, I know you won't.
Nope. All right, so let's go ahead and have you facing this way this time, okay? So shoulder right there, you're doing great. So this time, I know you're too tired for these jokes, probably.
I'm fine.
You doing all right?
I'm great.
Oh my gosh.
Till
It's
she
just a
eats that
thrill of
food
being
later.
Here.
Yes.
All right, go ahead and move forward just a half a smidge. Good, just like that. All right, good. So I'm going to drop that in that range. Bring that in there. I'm going to play with this here just a little bit. All right, so you hold that right there. We'll get all that stuff out of there and hold it. Look straight ahead. Don't breathe, don't move. Okay, doing great. All right. Okay, well, you should have a curve. Looks like my hand. Water, right? Just like that. You see how that's kind of straight except for that hump going the wrong way. Right. Okay. So.
I mean, mean, if it's gonna be messed up, I'm going all the way with it.
Yeah,
so.
but you know what though? I get so many horrible cases. Horrible cases. It's tough. It really makes it tough. So actually, we just talked to some people out of Canada, and they're going to be in process of coming. Already this year, we've had people from Spain, Mexico, Delaware, Texas, Florida, Kentucky.
That's awesome.
It's we got people from Illinois.
Yeah.
It's you know what? It's awesome from one standpoint in that it's good that people can find help. The sad thing is that you have to drive so far to find it. And what is, I mean, you have anybody you're working with at all over there? What is it? Is it a trust factor?
100%.
100%. Yeah, and that's the thing. And you've tried though, haven't you?
have.
So what was your experiences?
They weren't bad. It just wasn't long-term alleviation. It was more short-term, which I feel is
kind of like a
most-
Band-Aid almost. Even with all the money and everything, the education, all this stuff that these guys go through, guys and gals both, because you know. But I think somebody just told me just recently that there's a huge percentage of female chiropractors leaving the profession.
Really?
Yeah. Well, they want to do more things like what you're doing. You know, they want to take care of athletes like you. They want to be in the mix. They, if there's sports, they want to go ahead and participate. In that level. But unfortunately, the tools that they're given, it's like if you give it a hammer, everything's a nail, right?
Yeah.
And unfortunately, with you guys, there's a lot of nuances. And so you guys show up with some things that, a little bit different than that.
Yeah.
So, let me double check this here, make sure it's good. So 5, 4, 3, 2, roll up in through here. And I've got 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, and there's 1 and 2. Okay, good. So we are rocking and rolling in through here. So I got everything that I need from you there. So I'll go ahead and take my fancy schmancy Xena Princess Warrior starter kit off, right? So, do you remember that program?
Yeah.
Do you?
Yeah,
Was
I
it like
do.
your favorite?
No.
It really wasn't? No? Did you like Hercules?
I did like Hercules.
Yeah,
I
but
watched
you just
all of it.
Xena just wasn't. You weren't feeling it, huh? You could be like a Xena now.
I could.
You could. You better.
If Halloween was a little bit warmer.
All right, so listen, what we're going to do now is we're going to have Dr. Manny jump in here in just a little bit, and I'm going to go ahead and process these x-rays, and then we'll go ahead and give you a report, and then smack you around a little bit, all right? Sound like plan? All right, good team. All right, you going to do flex or anything? Muscle flex? No? Not this morning? All right, you have to wait for that later.
Okay, so follow the light for me, please. Good. Okay, stay looking at me and indicate to me verbally when you see my fingers move. Ready?
Yep.
Look forward for me. I'm just going to check your pupil reflex. Any numbers or tingling in the face? Raise your eyebrows. Up your cheeks. Sounds even weirder. Stick your tongue out. This way. That way. Any tinnitus in the ears? No. Let me know when you stop hearing that from your breast. Okay. There you go. Not bad. Okay. No hearing issues? No. Good. Okay, shrug your shoulders up. I'm gonna push down, don't let me. Good. Okay. Alright, now we're gonna test your ability to sense vibration. Okay? So, can you do this for me? You feel that?
Yeah.
Feel that? Feel that?
Yep.
Feel that? Feel that?
Mm-hmm.
That?
Mm-hmm.
This?
Yep.
That? This?
Yep.
Can you hear that?
Yep.
Can you hear that?
Mhm.
Okay. Alrighty. And deficits there. Okay. Stand by for me real quick. Let's see what's going on here. So, translation, negative. Flexion a little bit to the right, forward head posture. Antalgia, negative. Translation, negative. Shoulders higher. Have you noticed?
No.
Shoulders higher. And your foot is flat feet.
Hmm? So I've been told.
This one is flatter than the other one.
Okay.
Empty, thank you.
Yep.
That's. That is flat and right. Fed,
Oh, you need it on.
please. Okay, so now we're gonna start with the orthopedic test for the neck. And know where you feel pain, okay? Here we go. Down one. Turn that one. Here we go. This one. Here we go.
No.
Good. Try not to mess with it.
Oh, you're fine.
And is that one? There we go.
A little bit. Here.
Gotcha. Get some points in. Now I'm slowly gonna flex your head forward here. As I'm doing that, let me know if you have any particular symptoms going on your back. Okay. Stand your head forward. Press down again.
Hopefully you're the base.
Base.
Hopefully you're the right person.
So, I mean, it'll be interesting to see your x-rays, so. So, this one here, I have you turn this way. I'm not gonna let you, I'm gonna fight you, okay? Right there. This way. Right there. Come forward for me. Right there. Come back. Okay. Right ear to right shoulder. So like this. And then here. And
Yes. Yes.
Interesting. Is the internet down? Alright.
It is.
Alright, so for the next one, I just want you to turn your head and your shoulders, okay? My fingers here. And then look up here. Any neck pain there?
No.
The other side.
Yes.
Same side.
Yeah, right.
Right now, okay, so.
Now feel that. Isn't that wild? It's almost like I know what I'm doing. Yeah. Let's not get silly. But even in here, you can feel your dual head. Plump. You feel that?
I mean, I didn't feel it, but
Normally that hurts. That's sore. Because the short head rolls right over the top of it, right? So. Typically, that rolls in the collarbone there too. Feel it right there? A little bit more here. Now we go.
that block is fucking my little
Oh yeah, you got that
it's
right.
killing me.
Yeah, it's an interesting press
It's
position.
awful.
Mhm. It's awful.
But
It's just terrible.
Everything about it is awful.
Right there. So what we're gonna do now? Get your head back on straight. Okay. So right head, right neck. I know, right? So can we take the clip out?
This?
Yeah.
For sure.
I'll take it. Put it over here for you.
Yeah, whatever.
Got it. Ready? Put this in here. Then, that's a pretty powerful move. You feel that in your brainstem?
Yeah.
That's affecting your medulla oblongata.
Oh, I think you just hit my childhood memories.
Yeah, I might have. Some people do cry. All right. Like Christmas memories? That kind of thing?
Yeah, they're gone now.
Happy. Oh, they're gone.
You just knocked them out of my head.
All right, so I have to make new ones. I'm going to take this in here. Ooh. Occiput stuff is pretty significant when you move that. That affects your jaw too, so we'll check your jaw most likely after. Okay, now we're going to get number one. Number two is super twisted in there. So, what I'm going to do is I'm going to scoop it too. Okay. Now, we'll come back to one. One didn't want to go very easy. Bring your chin down. Did you feel it that time? So I should have went with number two to begin with because of the severity of rotation, but feel how that's all soft in there now? All right, so we'll leave the middle range alone and we'll go clear down here, all right? So, because it's awful jumbly in there. Clunk. This one I always tell people goes to your soul. I'm not just you sweating, I'm sweating too, you know, so that's crazy stuff. All right, so now what we're going to do is we're going to go ahead and check to see how your hip sockets are rolling, okay? So you feel that there, and you feel your pelvis rolls up, so you lift, stuck, super stuck right here. So I'm going to zip around the other side, see what that thing's doing. And a lot of people have low back pain, and it comes from this dysfunction. Most of us are sitting when we work these days. Recreation sitting, work is sitting, everything's sitting. And so nobody's taking into consideration a lot of those deviations and how you go from sitting to superstar athlete, right? So what I'm going to do now is I'm going to go ahead and touch your pubic bone where the two of them connect. We'll see which one's higher than the other. See if I need to go ahead and do an adjustment on that, right? So just tell me if it's sore, okay? You ready? So get right in through there. I already feel it right there. It's higher on that side. I'm gonna punch it. Yeah. Now, is any of that sore though?
No.
Okay. Well, that's a win. Most of the time, there's soreness, and it varies, right or left or whatever. So let's go ahead and just hook this right here. I'm gonna put this right in here. I know. You already know.
I do.
Have I done this before?
Yes.
Okay. So you remember.
Yeah.
There you go. Toss that over there. Okay, so now I'm going to do to finish it. I'm going to de-rotate this chunk. And you already feel how better that is.
Yep.
Relax your hip. Relax it. I'm going to go ahead and drop this in. There you go. Feel that the rest of the way? All right, now I'm going to come in through here. See how much better that is already?
Yeah.
Look at that. That really doesn't even need anything.
Okay, good.
Yeah, a lot of times that'll go from the pubis into that knee right there via the bacillus. So, and also a lot of times you'll go ahead and have that same kind of thing with gals that have a really heavy period and that kind of stuff. So, give me a hand. Up you go. Nose in the hole. All right. Woo, buddy. All right. How you holding up?
That's great.
Yeah, I know, right? Can't wait. You're just looking for a bed. Right leg up high as you can.
Oh, shoot.
Are you? That one little punch and all. Now you're awake, huh? Go ahead and scoot down a little bit, will you, kiddo? Gotcha. All right, right leg back high as you can, the whole right leg. Gotcha. And down. How about the other one? Gotcha. So that's easier on the left. So, right now she's got even though on the x-ray she's short here, that just shows she's compensating. She's a 1/4 inch short on the right, and then she goes 3/4 inch short on the right, and she has a right knee that's sticky. Alright, so left inferior, right post. So I'm going to go ahead and set this puppy. And there you go. There. Nice. Yeah, I think the biggest video that I did with the hips was with Nick Best.
Yeah.
Because his hip was awful. Oh, yeah. So, a lot of old history there for the video. And we actually did that, I think, the first Southern Illinois Strength Expo. I think I think that video is from there. So, now what we got to do is we got to go in here and we'll set the pelvis. You feel that in your belly a little bit? Mm-hmm. And then I need to take this, more of an EX. Okay? I'm leaving the hip sockets alone because I already did that. Now we're going to do the double AS focus. So booty up. There you go. All right, relax it. Now, if your back feels like it's binding in here a lot, and you may feel that because, like I said, that pelvis wants to do this, you can actually get a bolster and just lay on your belly like that and just open that space up. The other thing, too, is try and find the sweet spot for a reverse hyper. And see if you can keep that healthy in there. I mean, the more fluid, the more motion you have in there, the healthier this thing can be, right? So that's a piece of the equation. All right, so I'm going to do a double bump. And I'm going to go through the SI joints, and this here will de-stress this little sucker here. You feel that clunk?
Yep.
So open that up. Now what we're going to do is de-rotate. Now I could do a lateral rotation, but I'm not going to today. So I'm going to go right there. And that looks like a real simple nuance, but you feel how that slides up when I do that? And it just goes right through the joints themselves. So that's a winner chicken dinner for you. Okay, so right there. There. And here. Little spinous stuff. And you got most of the ribs out of there, so that cleared out pretty good, pretty quick. So now what I'm going to do is I'm going to go ahead and pull this up and de-stress the muscles that attach here to here. Iliocostalis musculatures. My hand doesn't bend very well, so I typically do that with my forearm. Still pretty effective, wouldn't you say?
Yep.
Go and take a breath. How's that feel in there? Is that relaxing that in there?
Yeah, feels good.
Nice. Okay, so let's go ahead. Right leg back high as you can now for me. Other leg. First one again, double check. That looks pretty strong. How did it feel back in here?
Good.
Does everything feel like it's engaging?
Yeah.
All the musculature is happy? All right, let's have you hop up and move around a little bit. All right. Yeah, I know, right? Did you see it all?
No.
Okay, let me see your face. Go ahead, open up. Yeah. So your jaw goes just like that. So let's bring you over here. I'm going to actually be nice to you and use the tool. So, yeah. Schoonwinkle, when I worked on him at the WSM, I wasn't nice to him. I didn't have this tool, so I had to whack him in the face. So, but he did really well, and his blood sugar dropped 80 points immediately. How weird is that? You have to talk to Peyton about that. Go ahead, Nathan Peyton, open up a little bit. Part of this is the fact that your head wasn't on straight. You sore? Okay.
I'm just weird.
Yeah, you're welcome. That's what I do.
Weird.
Like that
you're
guy,
right.
I know, right? All the time. Wipe. Wipe. Jeez. See? Something in there, wasn't there?
I guess.
Okay. Going to open wide again? Yeah, bite down now. Open wide. Now what you should do is that you wear, what mouth guard do you use?
Impact.
Yeah? You want to like do a promo on Impact mouth guards and how wonderful they are?
I mean, I love my Impact mouth guard.
And
pink.
are they sponsoring you?
No.
No, they should though, shouldn't they?
They should.
Yeah, no pressure. Okay, so but no, what I would do is now that I've got that reset, remold your mouth guard to fit what I just did,
Okay.
and that's gonna help, if you will, hold that stuff in place while you're exerting.
Okay.
That's a win.
Yeah.
Okay. So all right. So what we're going to do now is Dr. Manny's going to go ahead and reassess your squat and your overhead press.
Okay.
So okay. So we're going to get ready for that. All right.